Picture this, you're just chillin' at home, maybe watching your favorite show, and out of nowhere your chest feels heavy. Your arm goes numb, you can't breathe. Boom. Heart attack. And there's no one around. Scary, right? Here's the thing most people don't realize. During a heart attack, your heart muscle suddenly stops getting enough blood flow. That means oxygen can't reach the tissue that keeps your heart pumping, and within minutes, damage starts to kick in. That's why those first few minutes are a total make or break moment. A lot of folks freeze. Some think, maybe it's just gas or heartburn. Others try to tough it out. But every second you wait, your chances of surviving drop fast. That's why knowing what's really happening inside your body, and how to react, can literally save your life. When a heart attack strikes, your heart's main fuel line, the coronary artery, gets blocked by plaque or a blood clot. Think of it like a traffic jam inside your chest. The more the blockage grows, the less oxygen your heart gets. If that blockage doesn't clear, that part of your heart muscle starts to die. You might feel a squeezing or burning pain in your chest, pain spreading to your arm, neck, or jaw, shortness of breath or dizziness, cold sweats or nausea that hit out of nowhere. And here's a fact that surprises a lot of people. Not everyone feels that movie-style chest pain. Especially older adults and women. Sometimes the signs are way more subtle, like fatigue or a weird pressure in the back or shoulders. So what should you do? First, don't panic. That's easier said than done, but panic only raises your heart rate and burns more oxygen. Second, if you're alone, sit down immediately, preferably on the floor near a phone or front door. You don't want to risk passing out somewhere hard to reach. Third, call 911 right away. Don't try to sleep it off or wait and see. Even if you're not totally sure, paramedics would always rather come for a false alarm than show up too late. If you've got aspirin nearby, chew one, not swallow. It helps thin your blood and may reduce the damage. Just make sure you're not allergic or taking other meds that conflict. And if you've been prescribed nitroglycerin, take it exactly how your doctor told you. Remember, it's not about being fearless, it's about being prepared. When your body gives you that signal, don't ignore it. It's not weakness, it's survival instinct. Most heart attack survivors say later that they just had a feeling something wasn't right. Trust that feeling. Your gut can literally save your life. Okay, now you know what's happening inside your body during a heart attack. But what can you actually do to fight it off if help hasn't arrived yet? In the next part, we'll break down the life-saving steps you can take, even when you're all alone. Alright, so now that you know what's going on inside your chest when a heart attack hits, let's talk about what you can actually do to fight it off while you're waiting for help, because every second counts and panic is the enemy here. First off, if you're feeling those chest pressure vibes, sit down immediately, preferably somewhere safe near a phone and close to your front door, because once you lose coordination, getting to help becomes nearly impossible, and don't even think about lying flat unless you feel yourself about to pass out. Sitting at about a 45-degree angle with your knees bent and feet flat is the sweet spot that helps your heart pump blood and keeps oxygen flowing to your brain. Loosen any tight clothing like belts, collars, scarves, or ties because restrictive clothes can mess with your blood flow and make breathing harder, and keep your environment cool but not cold. Avoid bundling up even if you're sweating. Open a window if you can, but don't risk collapsing. Outside, and here's where things get a bit next level. Mastering controlled breathing can literally save your heart muscle, so take a slow breath through your nose for a count of 4, let your belly expand instead of your chest, hold it for 4, then exhale slowly for a count of 6 like you're blowing out birthday candles in slow-mo. This longer exhale triggers your parasympathetic nervous system, which slows your heart rate and reduces oxygen demand. Repeat this rhythm and put one hand on your chest and one on your belly so you can feel the belly moving more than the chest. It'll feel weird at first, but practicing it daily makes it way easier when the real deal hits. Another super important move is the cough CPR technique, which works only if you're conscious and your heart rhythm is starting to get irregular. Take a deep breath, then cough hard from your diaphragm every 2 seconds while breathing deeply in between. This pressure helps keep blood moving to your brain and buys you precious time to call 911 or grab your meds. Speaking of meds, if you've got aspirin, chew it immediately. Don't swallow it whole, because chewed aspirin hits your bloodstream way faster, up to 50% quicker, and if you've got nitroglycerin prescribed, take it exactly as your doctor told you, under the tongue while sitting down, and never more than 3 doses in 15 minutes. Finally, make sure your phone is fully charged and within reach, and if you live alone, keep a medical alert device on 24/7 even in the shower. Let neighbors know about your heart condition, leave a spare key with someone trustworthy, and consider putting up bright signs or leaving your front door slightly ajar so paramedics can get to you quickly. All these small, simple actions practiced ahead of time can mean the difference between life and death when you're alone and every heartbeat counts. Next, we're diving into the nitty-gritty of emergency communication and making sure help can actually reach you fast, because even the best survival moves won't matter if no one can get to you in time. First things first, having a proper emergency communication setup is absolutely critical, and it's more than just keeping your phone nearby. You need a plan that accounts for how your body reacts during a heart attack, because within seconds, lack of oxygen can make you confused, disoriented, or even temporarily paralyzed. And studies show that a shocking number of seniors forget their own address when calling 911 in the middle of an attack, so here's what you do. Write your full address, apartment number if applicable, and any gate codes or special entry instructions on a bright index card and tape it right next to every phone in your house, including your cell phone if possible. Program 911 as your first speed dial number so all you have to do is hit one button if your fingers are shaking. Keep your phone charged and within arm's reach, especially at night because nearly half of fatal heart attacks in seniors happen between 10 p.m. and 6 a.m., and if you live alone, get a medical alert device and wear it constantly, even in the shower, because research shows many seniors don't wear theirs when an attack happens and that can cost precious minutes. Now, here's another life-saving move. Tell your neighbors or building staff about your condition, give a trusted neighbor a spare key and let them know to check on you if your routine seems off, and in apartments, make sure the building manager or security is aware so paramedics can get inside fast, and for extra safety, leave lights on, hang something bright from your front door or window, and keep a whistle handy so responders can find you even if you can't speak. Plus tape a sheet with your name, medications, allergies, and medical conditions on the inside of your front door at eye level, and if you can, invest in a smart lock that can unlock automatically when 911 is called. All these steps may sound small, but combined, they drastically cut the time it takes for help to arrive, and every second matters, because being unreachable during a heart attack can make the difference between life and death. So take the time now to prep your home, your neighbors, and your emergency systems. It's the kind of insurance that actually saves lives when things go south fast. Now that we've got your emergency communication locked down, let's talk about one of the most powerful hands-on techniques you can use to buy yourself precious seconds and keep blood flowing to your brain while waiting for paramedics, and it's something most people have never heard of. First up is the cough CPR technique, which can be a game changer if your heart rhythm starts acting up but you're still conscious. Here's how it works. Take a deep breath, filling your lungs completely, then cough hard and deep from your diaphragm every 2 seconds, breathing in deeply between each cough. Think of it like manually pumping your heart to keep blood circulating. This isn't a substitute for calling 911, but if you start this at the very first signs of irregular heart rhythm, studies show it can give you nearly 2 extra minutes of consciousness to call for help or take your medications. Speaking of medications, if you have aspirin handy, chew it immediately. Not swallow, because chewing breaks down the coating and allows it to hit your bloodstream up to 50% faster, which matters when every minute counts. One regular 325 mg tablet or 4 baby aspirins is enough. And keep non-coated aspirin in multiple spots around your house, in your car, and on your person. Check expiration dates regularly and replace as needed. Next, if your doctor prescribed nitroglycerin, this is where it comes into play. Sit down immediately, place 1 tablet under your tongue and let it dissolve fully. Don't swallow, and if symptoms persist, you can take up to 2 more doses at 5-minute intervals, never more than 3 in 15 minutes. Storing nitroglycerin properly is key, in its original amber bottle away from heat, light, and moisture, and if you're taking erectile dysfunction meds, never combine them within 24 to 48 hours with nitroglycerin. Otherwise your blood pressure could drop dangerously. And here's a pro tip most people miss. Combining aspirin with nitroglycerin during a heart attack can boost your survival odds even further because aspirin thins your blood while nitroglycerin widens your vessels, giving your heart the best chance to keep pumping. All these actions together, done correctly, can literally be the difference between staying conscious and alert versus collapsing before help arrives. So practice the cough CPR, know where your aspirin is, and prep your nitroglycerin. Repetition and familiarity will make these steps almost automatic when you need them most. Up next, we're diving into the exact body positions and breathing techniques that can maximize oxygen flow to your heart and brain, giving you precious extra minutes during a heart attack. And while it sounds simple, it's actually super powerful if done right. First, your positioning matters way more than most people think. If you're feeling chest pressure, shortness of breath, or dizziness, don't just flop on your back unless you're about to faint. Instead, sit at about a 45-degree angle with your knees bent and feet flat on the floor or bed. This semi-upright position helps gravity assist blood flow to your heart and brain while taking some of the workload off your heart. It also makes breathing easier by letting your diaphragm expand fully. If you feel yourself getting lightheaded, lower yourself carefully to the ground using nearby furniture for support and then roll onto your side, preferably lying on your right side with your left knee bent, which keeps your airway open and prevents choking if vomiting occurs. Loosen any tight clothing like belts, collars, scarves, or ties immediately because restrictive clothes can restrict circulation and make it harder to breathe. Keep the environment cool but not cold, avoid bundling up if you're sweating, and make sure fresh air can circulate if possible. Next up is controlled breathing. This one can actually reduce heart muscle damage by almost half according to research, and it's called diaphragmatic or deep belly breathing. Here's how to do it. Inhale slowly through your nose for a count of 4, letting your belly rise more than your chest. Hold for 4, then exhale slowly through pursed lips for a count of 6. Like blowing out birthday candles in slow-mo, the long exhale triggers your parasympathetic nervous system, slowing your heart rate, lowering oxygen demand, and preventing panic-induced hyperventilation which can make things worse. Put one hand on your chest and one on your belly to make sure your belly is doing most of the moving. Practice this daily, even when you're healthy, so it becomes second nature in an emergency. Counting out loud if possible also helps maintain rhythm and signals to 911 dispatchers that you're conscious. Combining proper positioning with controlled breathing creates a powerful defense during those critical minutes, buying your body more time to survive until professional help arrives. And these small but strategic steps are completely under your control, so the more you practice them now, the higher your chances of making it through a heart attack alive and alert. Next, we're covering a life-saving tip most seniors never think about: how to make sure paramedics can actually get into your home fast, including door unlocking tricks and smart lock strategies that could shave off critical minutes. Here's the reality. Thousands of seniors die each year simply because first responders can't reach them quickly. So the very first thing you do when symptoms hit is unlock your front door immediately while you still have strength and coordination, if possible. Leave it slightly ajar, and for extra backup, mount a lockbox outside with a spare key and give the combo to your local fire department. This simple step alone has been shown to improve survival rates dramatically because the average person loses the ability to walk within 3 to 5 minutes of a major heart attack starting. Make sure all lights in your home are on, hang something bright from your door or window. And if you live in an apartment, call 911 first and then alert your building's front desk or security staff so they can meet paramedics at the entrance. Keep a whistle in your nightstand or on your keychain so you can make noise if you're unable to speak. And tape an emergency information sheet to the inside of your door at eye level with your name, medications, allergies, and medical conditions clearly listed. These small cues help first responders find you faster and provide life-saving information instantly. And if you can afford it, smart locks are a game changer. They can be programmed to unlock automatically when 911 is called from your phone, cutting response time by several minutes. Remember, every second counts when your heart is failing. And prepping your home ahead of time with these door, key, lighting, and smart device strategies can literally make the difference between life and death, so don't wait. Set up your communication and entry system today to maximize your survival odds when the unthinkable happens. Now that we've got your home prepped for rapid help, let's dive into a technique that can literally keep you conscious longer: the cough CPR method and how to use it safely while waiting for emergency help. This one's a game changer if your heart rhythm starts acting irregular but you're still alert, and while it's not a replacement for calling 911, it can buy you precious seconds or even a couple of minutes to get meds or reach a phone. Here's how it works. Take a deep breath, filling your lungs completely, then cough forcefully from your diaphragm, not your throat, every 2 seconds while breathing in deeply between each cough. The rhythm should be steady and strong. Each deep breath brings oxygen into your lungs while each cough manually squeezes your heart to keep blood circulating to your brain, essentially acting as a backup pump when your heart is struggling. Repeat this cycle continuously until help arrives or until paramedics take over. It's critical to remember this only works if you're still conscious and your heart isn't fully blocked. If you experience complete artery blockage, cough CPR won't help and could actually cause harm. That's why preparation is key. Knowing this ahead of time allows you to act immediately. Practicing deep breathing and the cough rhythm while healthy can make it second nature during a real emergency, combined with proper positioning, aspirin intake, nitroglycerin if prescribed, and being near your phone or medical alert device. Cough CPR adds an extra layer of survival. Studies show that using it correctly can extend consciousness by nearly 2 minutes on average. And in a scenario where every heartbeat counts, those extra seconds can be the difference between life and death. So learn the technique now, make it part of your daily awareness, and always remember, it's a bridge to professional help, not a substitute. But when you're alone and panic is setting in, it's hands down one of the most powerful moves you can make to stay alive. Now let's get into the proper aspirin and nitroglycerin protocol that actually works during a heart attack, because most seniors don't know the right way to take these meds, and timing here is everything. First, aspirin, which helps thin your blood and prevent clots from growing, is most effective when chewed instead of swallowed whole. Chewing breaks down the coating and lets it absorb through the mouth's lining, hitting your bloodstream faster. Ideally 1 325 mg tablet or 4 baby aspirins. At the first sign of heart attack symptoms, keep non-coated aspirin in multiple locations around your house, car, and on your person. Check expiration dates regularly, and replace as needed to ensure effectiveness. Next, nitroglycerin, which widens your blood vessels, reduces workload on your heart, and improves blood flow through partially blocked arteries, must be used exactly as prescribed. Sit down immediately before taking it because standing can drop your blood pressure dangerously. Place 1 tablet under your tongue and let it dissolve completely. Do not swallow. You may feel a tingling or burning sensation which signals it's working. If symptoms persist, take a second tablet after 5 minutes, then a third if needed, never more than 3 in 15 minutes. Store nitroglycerin in its original amber glass bottle away from heat, light, and moisture. Replace it every 6 months. And keep bottles in multiple locations for quick access. Never mix nitroglycerin with erectile dysfunction meds like Viagra or Levitra within 24 to 48 hours because it can cause a fatal drop in blood pressure. And here's a pro tip. Combining aspirin and nitroglycerin correctly provides maximum benefit, with studies showing survival rates jump significantly compared to using either alone. Having both ready and knowing exactly how and when to use them can literally be the difference between making it through a heart attack conscious and alert versus collapsing before help arrives. So, practice the sequence, keep everything accessible, and make sure you understand dosage, timing, and safety rules ahead of time, because in these critical moments, speed and precision are your best allies and could save your life. Alright, now it's time to wrap everything up and give you a full recap of all 7 life-saving techniques, because knowing them once isn't enough. Practice and preparation are key if you ever find yourself alone during a heart attack. First, remember the emergency communication setup. Keep your phones charged and within reach, have 911 on speed dial, leave a spare key with a trusted neighbor or in a lockbox, and make sure lights, signs, and whistles are ready so paramedics can get to you without delay. Next, positioning is everything. Sit at a 45-degree angle with knees bent, use pillows for support, roll onto your side if you feel faint, loosen tight clothes, and keep the room cool to maintain oxygen flow. Third, controlled breathing. Slow diaphragmatic breaths, Inhale for 4, hold 4, exhale 6, repeat. Hands on belly and chest to check movement, prevents hyperventilation and keeps your heart calmer. Fourth, cough CPR. Deep, forceful coughs from your diaphragm every 2 seconds while conscious, manually pumps blood to your brain and buys precious seconds. Fifth, aspirin protocol. Chew a 325 mg tablet immediately. Keep extras in multiple locations. Sixth, nitroglycerin. Follow exact doctor instructions. Sit down, under tongue, up to 3 doses in 15 minutes. Avoid mixing with ED meds. Store properly and check expiration. And seventh, inform neighbors and building staff about your condition. Share your emergency plan, and make sure someone can reach you fast if you lose strength. Practicing all these steps daily, from breathing and positioning to knowing your medications and prepping your home, makes your response automatic when panic hits. These techniques are proven by cardiologists and emergency experts to increase survival odds dramatically, and while they don't replace professional help, having them down cold can literally be the difference between staying conscious and alive or succumbing before help arrives. So print out instructions. Rehearse them, keep your meds and devices accessible, and share this information with every senior you know. Preparedness and knowledge are your best defense when a heart attack strikes alone. Now that you've learned all 7 life-saving techniques, it's time for the ultimate motivational push. Remember, knowledge alone isn't enough. You've got to practice these moves daily so they become second nature the moment a heart attack hits. Run through controlled breathing, positioning, and even the cough CPR rhythm while you're calm. Check your aspirin and nitroglycerin supply regularly. Make sure your phones are charged, your medical alert device is on, and your home entry plan is set. Share these instructions with your friends, family, and neighbors, because heart disease kills more seniors over 60 than anything else, and the more people who know what to do, the more lives you can save. Keep printed instructions somewhere visible so you don't have to think when panic hits. Remember that every second counts, and these techniques aren't meant to replace medical treatment. They're meant to buy you critical time until professional help arrives. The average emergency response is 8 to 12 minutes, and having these steps ingrained can literally mean the difference between life and death. Now we want to hear from you. Have you or a loved one ever faced a heart emergency alone? What's the one thing you wish you had known beforehand? Drop your story in the comments because sharing it could help someone else survive. Stay aware, stay prepared, and remember, your heart and your loved ones will thank you for taking these life-saving steps seriously, because when seconds count, preparation isn't optional, it's everything. If you found these tips helpful, smash that subscribe button and hit the bell so you never miss another life-saving tip for seniors. Stay safe out there.